Hip hinge unweighted deadlift. A hip hinge is the key movement to help prevent back pain when bending over. Start with your feet about shoulder length apart, side by side and toes pointing forward. As you shift your weight onto your heels, push your hips backwards and hinge forward at your hips. End range is about midway between vertical and parallel to the floor. Allow your knees to bend only slightly. Slowly return to your upright standing posture by contracting your glutes and pushing your hips forward and upward without arching the back. You can use a PVC pipe or a dowel to help maintain this correct posture. There should be 3 points of contact with the PVC and your body: the back of your head, between your shoulder blades, and the buttocks. Maintain contact between the bar and your body throughout this whole movement. When a hip hinge is done properly, there should be no pain in the low back. The movement should be hip dominant, the buttocks will stick out behind you as your hips flex, and your spine should stay neutral throughout the entire movement. Your knees will have a slight bend to them. You can use your lower hand as guidance as well, and it should remain in contact with your low back to prevent any arching. Weighted deadlift. You can progress the hip hinge to a weighted deadlift by using kettlebells, dumbbells, barbell, or trap bar. With this demonstration, we are using a kettlebell. The movement is exactly the same as a hip hinge, except for the fact that you are holding a weight in your hands. Imagine you have a bar in contact with 3 points: head, shoulder blades, and buttocks. Make sure you are activating the core and squeezing the shoulder blades down and back to maintain a straight spine. You will then proceed just as you did with the unweighted hip hinge. Shift your weight to your heels, push your hips back, and hinge forward at your hips. Knees will bend only slightly. Return to upright standing posture by contracting your glutes and pushing your hips forward without arching your back. Be very careful of your shoulder position while holding the weight, and do not allow your shoulders to round forward. Single leg deadlift with foam roller. Using a foam roller to assist with a single leg deadlift can help teach the proper form and technique. Keeping your hand and foot in contact with the foam roller will help keep the spine straight and prevent the common mistake of allowing the trunk to fold over. To perform this movement, place the foam roller on top of one foot and hold it there using the same side hand. Shift your weight to the opposite leg. Slowly raise the foot with the foam roller and lift the leg behind you. As the leg raises, keep your hand on the foam roller and hinge at your hip to guide your upper body forward. The stance knee may bend very slightly. Your spine should stay neutral and your body should hinge forward from the stance leg's hip. Stop the movement when you feel a stretch in the hamstring of your stance leg. Return to starting position by maintaining the neutral spine and slowly lowering the leg with the foam roller and raising your upper body back to the standing upright posture. Repeat on the other side. Single leg deadlift. To perform a single leg deadlift without assistance and without weight, start with your feet together and shift your weight to one side. Slowly lift the unweighted leg into the air behind you, keeping the knee straight, and think about pushing the heel behind you. As the leg raises, start to slowly hinge forward from the hip, lowering your chest and raising your arms as the leg raises behind you. From head to toe, the body should move as a straight line and your spine should stay neutral. Try to keep the toes of the rising leg facing the floor to keep hips in alignment. Stop when you feel a stretch in the hamstring of the stance leg. Return to the starting position by maintaining a neutral spine and slowly lowering the raised leg and bringing the upper body back to a standing upright posture. Repeat on the other side.